Up to now, we have discussed those typical milestones that you see in development from birth up until about 5 years of age, which is really where you're going to be asked a lot of those milestone questions on the test. But growth and development, of course, continue beyond that stage throughout life. And so we're going to discuss middle childhood here, which is used to be known as latency, and it was known as latency because these children were considered latent before puberty. So this roughly corresponds to the period from about 5 years of age, where the child really makes the bulk of their development from infancy up until the age of puberty, which can vary when the first signs of puberty hit. But usually we can define this as a mean of about 11 years of age. So we're talking generally about the years that a child is in elementary school. So this will begin with the beginning of regular school attendance, usually like kindergarten, and there are a lot of skills that a child needs to obtain, and some anxieties that need to sort of phase out before a child can start school successfully. And then it ends with the onset of pubertal changes, which we consider to be adolescence. During middle childhood, around 7 years of age, there is a shift in thinking. Piaget's stages from pre-operational thinking to concrete logical operational thinking. We'll discuss that a little bit. And then this is also a period where a child's self-esteem really becomes a critical issue, and that can come into play when we're talking about mood disorders and anxieties. Physically, it's not a whole lot of dramatic physical development during this period. This tends to be a period of really good health. Most of the dramatic physical development happens from birth to about 3 years of age, and then the child will continue to grow height-wise, but another dramatic stage in growth won't happen again until puberty. There is one thing, though, that does happen characteristically during this period is the child loses teeth. So the baby teeth will begin to fall out at around 6 or 7 years of age, and these are replaced by permanent teeth, and the permanent teeth will come in at about 4 teeth per year as a rate, and usually it's going to be the incisors and the canines that come in before the molars. Myelinization of neurons completes by 7 years of age, and there becomes some pruning, and this allows the child to develop higher cognitive skills, as well as refine their gross motor strength and fine motor skills. Gross motor strength and fine motor skills really begin to blossom during this period, and children a lot of times become involved in sports, dancing, music, piano, other activities that require coordination and refined motor skills. A lot of times they'll develop hobbies like art and drawing and Legos and whatnot. That having been said, especially with regards to sports, prepubertal children should not engage in really high stress or power contact sports by virtue of their skeletal immaturity. So children who are 8, 9, 10 years old, who, especially boys, tend to be in sports more than girls, though that's kind of changing, but definitely more in the power contact sports. They really should avoid sports like American football, where there's tackling, until they have some more skeletal maturity, until they hit puberty and their muscle mass develops to where they can protect their bones. And so it's really, I mean, if you talk to one pediatrician versus another, or a neurologist, they're going to have different opinions on this. But the overall consensus is that children who haven't hit puberty yet really should abstain from some of those more higher contact sports. So physical changes and exposure to other children, because children develop at different rates, this is going to make the child aware of their uniqueness, and that can also raise some self-awareness to their body image, because if some friends are getting taller and one child is shorter, or sometimes the girls will hit puberty a little earlier than boys will. And so if you go and look at a class of fourth graders, girls are usually starting to grow, hit their growth spurts, whereas the boys are not. And so you could take a class of second graders, boys are usually a little taller. Take a class of seventh graders, boys are usually a little taller, but then that little awkward period, fourth, fifth grade, the girls are actually a little taller than the boys. And so all these things are going to fuel into a child's curiosity and self-awareness of their body. So I just wanted to bring up and highlight this. You'll see a lot of parents will bring children in, and it's important to ask them about the child's activity level. Now, it's obviously very important for a child to be active, as we know that obesity is an epidemic in the U.S. and other places in the Western world. But there are some activities that are really discouraged. And one common activity in the U.S. in the summertime would be things like baseball. And in general, baseball isn't a bad, real high-contact sport, but particularly pitching, where these children are encouraged to throw the ball as fast as they can. Their ligaments and their bones are really not developed to significant enough maturity to where they should be throwing the ball as fast as they're often asked. And actually, there are children now that are getting Tommy John surgery, and that's usually a surgery that we see in professional athletes, particularly baseball players. And there are children now who are 11, 12 years old who are getting Tommy John surgery because of the demand that youth sports are placing on their athletic ability. So it's, like I said, it's important to ask the parent how much activity the child's engaging in, but you don't want the child to be overextending themselves to the point where they can get into injury. And in case you didn't remember, Tommy John surgery is an orthopedic surgery. It's a replacement of the ulnar collateral ligament. Cognitive development is really monumental during this period. There's a shift in cognition from perception-bound thinking to that's more based on a more logical thinking, particularly inductive logic. So here you shift from perception-bound thinking to that's based on fixed rules that's gathered from observable phenomena. So children are able to see things and they're able to induce ideas based off of that, rather than just being told everything and remembering facts or rules. Appropriate school readiness will require sufficient development in the three areas of skill that we have been talking about that are part of your milestones for young children, and also part of milestones for older children. So physical and motor milestones, definitely fine motor skills are going to be necessary for writing. All these things are really important for being able to function in a school environment. Cognitive development needs to have developed to where they have sufficient memory, language skills, phonology, and then their social development. This is probably where you see a lot of the problems. They need to be able to pay attention. You see problems with children with ADD, ADHD, or suspected ADD, ADHD. A lot of teachers will tell parents to bring your kid to the doctor because I think your kid's got ADD, and a lot of times they do, but a lot of times they don't. It's a lazy teacher. No offense. But they also need to be able to manage their separation anxiety from their primary caretaker. Remember, separation anxiety sets in really early, and it's obviously an evolutionary thing. We're not supposed to wander too much from our parents when we're really young, but at some point we need to be able to suppress that as when children go to school, provided they're not homeschooled. But as children go to school, they are going to be away from their parents for hours at a time. And then, of course, children need to be able to internalize rules. And this generally, child is usually able to do this a lot younger than 7 years old. But they need to be able to internalize rules and not have to be constantly told when a behavior is appropriate or not appropriate. They should be able to develop at least a very basic sense of right and wrong. Many children will develop hobbies based on their increasing cognition. So you'll see children that like to play board games like chess and checkers that require strategy. A lot of them will like to read for pleasure, so not just reading school books, but reading things just for the enjoyment of it. You'll see that they will a lot of times be involved in bands. That requires them to be able to read music, which of course is a very a high-level cognitive skill where you're converting something visual to something that you should do with your hands and creating music from that. And of course, card games, you'll see them doing too. So in general, these hobbies are all centered around higher level cognitive skills, strategy, hand-eye coordination, and being able to think through multiple steps. And that's all based on the developing frontal cortex and upper temporal lobe. These are Piaget's stages. So during middle childhood, the child is shifting into concrete operational thinking. So what happens during concrete operational thinking that the child is able to grasp this concept of conservation? I talked about this in some of the earlier sections, but essentially what conservation is knowing that the classic example is if you put 2 glasses of water in front of a child and they're exactly the same glasses, same amount of water, and the child can see that, and the child will say, yes, they're the same amount of water, they both have the same in them. And then you take one of the glasses and pour it into a really high glass, but high and narrow. And so, of course, when you pour the water into that high and narrow glass, it's going to be taller. And a child that has developed conservation will say, well, no, they're still the same, even though that one appears higher. But a child who hasn't developed conservation will say, well, that one's got more because it's taller. Usually children will view taller as more. So conservation means that the child is able to distinguish that, for instance. There's also an ability to comprehend that someone else may have another opinion, even though the child can still believe that that opinion or thought is wrong. They're able to understand that other people have different opinions, and this is a big shift from that egocentricism that predominates during preschool-aged children. So around 7, 8 years of age, they should be able to understand that other people have different outlooks. And the way that this is tested by child psychologists is called the Sally-Ann test. Now, you don't need to know this for the test, but it's interesting to know just from a psychologic point of view what this means. In this case, you have an experiment where a child is presented with 2 dolls, and they can be named anything. They were supposed to represent people, so you can call them Sally and Ann. And both of the dolls have a box, and Sally is given a marble. The doll is given a marble, and the experimenter has Sally place the marble in her box, and then they remove Sally from the room while the child's still in the room, and then Anne, the other doll, takes Sally's marble from her box and places it in her own box, into Anne's box, and they bring Sally back into the room, and the child is then asked, what box is Sally going to look for the marble in? And whereas a younger child would say, well, Sally's going to look inside Anne's box because I saw the marble placed in Anne's box, therefore Sally's going to look into that box too. A child who is in the concrete, logical, operational thinking stage is going to say that Sally will look in her own box because Sally has no reason to believe that the marble isn't still in there. So that's a test that supports that the child has transitioned into this higher level of thinking. And then finally, inductive reasoning. So inductive reasoning is basically A equals B, B implies C, therefore A implies C. So Bobby's dad is a doctor. I know doctors are smart, so that means Bobby's dad must be smart. Sounds really logical, but that is actually something that doesn't develop until this period around 7 to 11 years of age. Deductive reasoning, on the other hand, which is more scientific abilities, like forming a reasonable hypothesis based on what you've observed. So being able to understand something that you haven't observed based on things that you have observed. This is deductive reasoning, and this doesn't really develop until the teenage years. So the increasing cognitive demand in the classroom can bring learning or behavioral issues to light that may not have been noticed before the child started kindergarten, first grade, when the child was still just in the house. And particularly what we see most often in the family practice setting is ADD and ADHD. And this is very common. To what degree it actually is a disorder and is normal childhood development is up to debate. However, there are formal diagnostic criteria for what the American Psychiatric Association considers a disorder and what we can treat. So attention deficit or hyperactivity disorder, so it can be either attention deficit disorder or attention deficit hyperactivity disorder, is characterized by inattentiveness or hyperactivity for at least 6 months in at least, and this is most important here, in at least 2 different environments. So if the child is just having these functioning abnormalities at home, or usually it's at school but not at home, then that's not ADD or ADHD. So it needs to be in at least 2 different environments, and these things need to interfere with function. So I'm not going to go into all the criteria for ADD and ADHD here. There are criteria. Probably when I made those videos, the DSM-5 hadn't been released yet, but if you go back to the child psychiatry lecture, I did talk about ADD and ADHD. I don't think the criteria have changed a whole lot from DSM-4 to DSM-5, but I haven't really parsed through DSM-5 a whole lot yet. But for the most part, it's the same concept. Other problems can come to light during this period, which particularly includes learning disabilities. Now, I can tell you that there has been a change from DSM-4 to DSM-5, where in DSM-4 there was mathematical learning disability, reading learning disability. Now they are all lumped into just flat-out learning disability, and there's subtypes to them. So this is all kind of trivial, but that's sort of how the DSM has changed. Learning disability can come to light, and certainly does come to light as the demands increase from month to month as the child progresses in school. Also note that difficulties performing in school might not necessarily be a learning disability or even be ADD or ADHD, but it can also reflect an underlying mood disorder or an adjustment disorder. So particularly what you might see is if a child has been performing really well in school or average in school, and suddenly the family moves to a different town, the child's going to a different school, and the grades drop off. That would be a classic example of an adjustment disorder. So difficulties performing in school can be other things, and definitely for ADD, ADHD, learning disabilities, you always have to rule out some kind of underlying psychiatric disorder before you can jump to the conclusion that it's a learning disability or ADD. Social development is going to be probably, I would say, the most dramatic of all of these 3 areas of development, and that's because the child is now in school. The child is into peer groups now, and so there's going to be an increasing independence. It's appropriate to expect the child to perform physically and age-appropriate domestic chores around the house, and it's actually encouraged. Because chores instill a sense of responsibility and ethic, and that can be really useful for later functioning, particularly during adolescence. Usually in the U.S. it's around 16 years old when the child can get a job outside the house, and that's going to be important for adult functioning. So we're really starting all this very early on. So chores are really the beginning of helping the child learn a sense of responsibility, which is going to be imprinted in the child and is going to play a big role in further development ultimately leading to being able to function as an adult. Another good thing about chores is that you can give a reward. You don't want to just give money to a child. If you just give money to a child, give allowance to a child, and you don't expect them to do chores, well, they're going to think that that money just grows off trees, as we say, or that money just comes out of nowhere and they just deserve the money. Whereas if you expect a child to do chores, they do the chores, even if it's not perfect. They do the chores, making some kind of effort, and then you give them an allowance. They see that allowance as a reward for something they did, and then they can spend that money, and that also helps them with learning the value of a dollar. And that also reinforces industriousness and independence. I can tell you, when I was like 4 or 5 years old, I went with my mom one time to the ATM machine, and I was like, "Mom, how come, if you don't have enough money, you're complaining we don't have enough money, why don't you just take $2,000 out of the ATM machine instead of 200? And she told me, it doesn't really work that way. And I didn't understand it at the time, but obviously, as you get older, you learn what money means. So, in social groups, children will often become aware of physical differences. We kind of talked about this earlier. This can be problematic in some cases if a child is of a racial minority, or if a child is obese, or if the child has any deformities. This can cause ostracization. Children are cruel. That's just how they are in social groups, and even though that's inappropriate, that's just the nature of it. So ostracization can really become incorporated into that developing self-image, and that can negatively affect school performance as well. So you want to know if a child is being bullied or ostracized. That's really important, and there are ways that you can work with the school to try to minimize that. So here's a good example of age-appropriate chores, and I have to stress that these need to be age-appropriate chores, and not just age-appropriate, but appropriate for the child's physical abilities, and taking into account any physical handicaps if they have any. So you can really start expecting the child to do certain things on their own at 2 years old. That's really young, but you can actually expect that. So something at 2 years old, expecting the child just to pick up their toys and books. You might not give your 2-year-old money at this point, but it's never too early to start expecting them to function as part of the family unit. But definitely by 4 or 5 years of age, they can do things like set the table, straighten their room, get the newspaper. All these things are pretty safe things. And then by the time they get to be about 12, they're doing much more sophisticated, more adult-like things like babysitting, ironing, maybe even cooking some simple meals. So obviously the burden rests on the parent to make sure that all of these things are done in a safe environment, but these are things that can be appropriate for a child to do. And of course, like I said, allowance, even if it's just a small amount, is really, really good for the kid to learn how to be industrious and understand what money is, so that when they go to the store with their parents and they say, well, I want that, and mom says, well, I don't have the money for it, they might have some insight as to what that means. Between ages 5 and 6, children will have typically formed a conscience, and a conscience has a lot of different meanings, but what we mean here is the internalization of the rules of society. And that's not just, that goes beyond the rules that mom and dad tell you, that you can't watch TV after 8 o'clock, or you can't throw a ball in the house. That means the rules of society, right and wrong. And so that would be things like you can't steal, or you shouldn't litter. So this is affected, obviously, by the parent, and the parent's displayed morals and their ethical behavior. And so if the parent does things that are immoral or wrong, you can only expect that the child is going to do that too. But conscience will develop between ages 5 and 6. And then some children will face particular stressors, unfortunately, that can have some significant implications on their mood, and that can affect their development, at least in the short term. And some things that are unfortunately common include separation and divorce of parents. That's very, very common. We have a 50% divorce rate in this country, and a lot of times children are caught up in the middle of that. And if it's a child, that's maybe 1 or 2 years old, they might get off a little more scotch-free. Whereas if this is a child that's in a critical part of their development, especially middle childhood or early adolescence, where they can't really understand this, a lot of times they're going to blame it on themselves, and that can really affect their mood. Other things that are more unavoidable would be like the death of a loved one, such as a grandparent or especially a family pet. That can really affect them too. And then things like moving, that can also be unavoidable sometimes. And then more severely, things like domestic violence. Which, by the way, if you ever see any signs of domestic violence in a child, you're mandated to report that to state authorities, and that will come up on boards. Children at this age are still quite sensitive to what they see in the media. No child at this age should have a TV in their bedroom. And the reason is not because we don't want them to watch too much TV, it's that it's not good for children at this age to watch TV alone. Because they're still sensitive to what they see. They don't necessarily know what is real and unreal, what's maybe right or wrong. And so they can become scared from that, confused, especially with the mass portrayal of violence that we see on TV all the time. And then finally, bullying, either those who bully or are bullied, has a very strong association with mood disorders, family issues, or adjustment problems. And so if this is a common problem, not just an isolated event, but really a common problem, the child should be evaluated.